So thinking about bilirubin right from the beginning, 80% of the bilirubin in your bloodstream is derived from the degradation of aging red blood cells, aging erythrocytes. And the other components are made up from heme proteins from the bone marrow and degradation of myoglobin, which is the muscle pigment. So these old erythrocytes are degraded by the monocytes and macrophages, typically in the spleen. And then the bilirubin is released and it's complex to albumin. So albumin carries the bilirubin around your body. You have a very, very small amount of bilirubin in your bloodstream, which is soluble and complex to other things. But most of it is insoluble and carried by albumin. So once it's been released from the red blood cells and it's complex albumin floating around your bloodstream, your liver is in charge of the next part of the process. So carrier-mediated transport uptakes that bilirubin. And essentially what will happen is that the bilirubin will be conjugated, and so it will be made soluble. So the albumin will be taken off the bilirubin, and it will be complex with things like glucuronic acid. And then it's excreted into the biliary tree against a concentration gradient. And then the biliary tree will carry the bilirubin down to the intestinal tract. And then in the intestinal tract, it will be metabolized by the gastrointestinal bacteria, and it will become urobilinogen, and eventually it will be oxidized to two other pigments, and those are the pigments which give rise to the brown coloration of stools, essentially. People do talk about white stools in animals with complete cholestasis. I guess theoretically it makes sense, but I think it's extraordinarily rare. So it's something that I would regard as a phenomenon rather than anything likely to occur in a clinical case. When it comes to urine, there are some important things to think about with bilirubin. So bilirubin in the urine is soluble bilirubin. It's bilirubin that's conjugated with glucuronic acid. In normal animals, there's very small amounts of soluble bilirubin in the bloodstream. The dog has a lower renal threshold for that soluble bilirubin than the cat. So in the normal dog, some soluble bilirubin, the very small amount which is present in your bloodstream, may appear in your urine. But in cats, the renal threshold is higher, so you won't see bilirubin appearing in the urine until the animal is hyperbilirubinemic. So a small amount of bilirubin in a dog can be entirely normal, but bilirubin in cat urine is never normal and tells you essentially that the cat is hyperbilirubinemic. So you need to go back and do some bloods and see what's going on. The dog can also conjugate bilirubin in the renal epithelial cells as well. So it can make some of the bilirubin, which is circulating in the bloodstream attached to albumin, can make it soluble and kind of excrete it into the urine as well. So bilirubin in cat urine, never normal. In dog urine can be normal. Okay, so important things to remember. So the differentials for jaundice, essentially, I'm sure you're all entirely aware, are prehepatic, hepatic, and posthepatic. So when we're confronted with a jaundice patient, these are the first things which we need to try and understand: to which group does our patient belong? So when they have a prehepatic cause of jaundice, it's essentially over rapid hemolysis of red blood cells. So we're going to expect these patients to be anemic. Very occasionally, they will maintain their red blood cell count but have a profound reticulocytosis. So they're destroying lots of red blood cells, but they're maintaining a normal PCV by pumping out reticulocytes like there's no tomorrow. But you should certainly see hematological abnormalities anyway. Hepatic, absolutely a possibility. For your liver function to be so poor that you become jaundice, it's a very, very significant dysfunction. So the liver has the capacity to deal with about 30 times more bilirubin than it needs to. So it's a sign of pretty significant hepatic dysfunction. And then, of course, problems with the posthepatic system. So problems with the excretion of the bilirubin from the biliary tract into the intestines. And that could be something in the biliary tree itself. The pancreas, of course, lives right at the end of the common bile duct and the duodenal papilla. So it can be the inner workings of the biliary tree or the outer workings of the biliary tree.